Is intracranial hemorrhage hereditary? Have you ever wondered if intracranial hemorrhage could run in families? Intracranial hemorrhage is a serious condition where bleeding occurs inside the skull, either within the brain tissue or in the spaces around it. This can lead to severe complications, including disability or even death. To understand if it is hereditary, we need to look at the different causes of this condition. Most cases of spontaneous intracranial hemorrhage in adults arise from factors like high blood pressure, trauma, aneurysms, or arteriovenous malformations. These causes are not typically inherited in a straightforward manner. This means that for most individuals who experience intracranial hemorrhage, there isn't a direct hereditary link. However, there are some rare genetic disorders that can increase the risk of intracranial hemorrhage. One such condition is hereditary hemorrhagic telangiectasia, also known as Osler-Weber-Rendu syndrome. This genetic disorder is caused by mutations in specific genes and leads to abnormal blood vessel formation. Individuals with this condition are at a higher risk of experiencing bleeding in the brain and other organs. Another example is Moyamoya disease, a rare condition that affects blood flow to the brain. It can run in families and is linked to mutations in the UNF-200 gene. This disease causes the arteries inside the skull to narrow, which can lead to both ischemic and hemorrhagic strokes. While Moyamoya disease is more common in certain populations, it can affect anyone. There are also other rare genetic conditions, such as specific types of cerebral amyloid angiopathy, that can make individuals more prone to intracranial hemorrhage. In these cases, gene mutations can cause abnormal protein deposits in the blood vessels of the brain, increasing the risk of bleeding. For most people, intracranial hemorrhage is not directly inherited. Lifestyle factors, underlying health conditions, and environmental exposures play a significant role. If there is a family history of intracranial hemorrhage or a known genetic disorder, it may be wise to seek genetic counseling and testing to evaluate individual risk. In summary, while most cases of intracranial hemorrhage are not hereditary, certain genetic conditions can elevate the risk. These include hereditary hemorrhagic telangiectasia, Moyamoya disease, and specific forms of cerebral amyloid angiopathy. If you have a family history of these conditions, consulting a healthcare professional is essential for personalized advice and risk assessment. Understanding both genetic and non-genetic factors is crucial for proper diagnosis and management of intracranial hemorrhage.